Hello, I'm Joy Jackson. I'm the Clinical Risk Coordinator for Erlanger Health System, and I'm here today to talk to you about documentation. So what is documentation? Documentation is anything written, printed, or electronically entered in a patient's record. It is the history of a patient's care while at our facility, and it is an important way to communicate with other members of the patient's care team. It's also the foundation of all third-party reimbursement. It is the legal record, particularly important in professional liability suits. And documentation demonstrates the measure or lack of quality when assessed by the Joint Commission, DNV, peer review committees, the state, etc. So why should you document? Well, it serves as a record that care was performed and the times it occurred. It provides information regarding changes in the patient's health status and the interventions performed. It helps to justify maintaining or increasing resources to the patient care area, and it is a legal requirement. So what should be included in documentation? Document facts, not opinions. Perform assessments using your senses: touch, sight, hearing, and smell. To avoid bias when documenting a patient's statements, use quotes. Please do not be afraid to quote our patients verbatim. Do not be afraid of offending anyone's tender sensibilities by quoting the curse words that are sometimes used by patients. We've heard it, and we can take it. Please quote them directly, particularly if it is pertinent to their care. Now be accurate. Be specific and use exact measurements when possible. This does not mean carrying a tape measure from room to room. You can estimate the size of a dollar, the size of a quarter, and then you can always come back out and measure that device. If you are writing anything by hand in a patient's chart, please make sure it is legible. And don't make up abbreviations. There was one time I read in a chart where nursing care performed TBA. Now usually TBA means to be assigned or to be arranged, but in this case, after I spoke with the nurse, it meant total bedside assessment. So please don't make up any kind of abbreviations. When to document. It is preferable to document at the same time as your assessment and or treatment. Make sure to date, time, and authenticate each entry with your signature and credentials. And remember that any lag in documentation may compromise patient safety, and it undermines the credibility of your entry. So what if a patient refuses a prescribed treatment? Document the refusal, including the patient's stated reason. Also document your actions. For example, teaching the patient about the treatment and notifying the physician. If the patient later complains that you didn't take care of them, but then it is found in the patient's record that the patient refused this care, that will help prevent any kind of action. Avoid gaps whenever possible in the medical record. Now, the EMR, electronic medical record, should help eliminate gaps because you're prompted to document what's considered standard. However, it doesn't always do that, particularly in regard to pressure ulcers or skin care. You also will need to document adverse events. And to properly document them, first you'll need to document the relevant clinical facts related to the event, as the assessment of your patient's condition, the prescribed treatment, and nursing and medical interventions. Never document that the event report was filled out because that is confidential under the Tennessee Patient Safety and Quality Improvement Act of 2011. It cannot be requested. And never document the alleged cause of the event. You may see a patient laying on the floor, but you don't know that the patient fell. You would document that the patient was found on the floor. If the patient states that he or she fell, then you would document that the patient stated that they fell and how it happened. So what to document about in a pressure ulcer? On admission, assess your patient's skin and wound, if there is one, and write a detailed initial assessment. Document the type of support surface the patient is on, whether it's a specialty mattress, the standard mattress in your area, and if Mepilex is in use. And document whenever a support system change is ordered. Document the turning and repositioning of your patient, the location of where they wound up, left side, right side. And even if you're offloading, if a patient is too unstable to turn, which I have seen many times in a record, please remember to offload the area by placing wedges under one side or the other to help reduce the pressure to the bony prominences. Notify the physician if there is a skin or wound problem, and it is a nursing action to request a wound care consult, and make sure you document that request. Whenever a patient is discharged, when they have had any kind of wound issue, please record in the discharge note the skin and wound status. Do not copy and paste previous Don't copy and paste the previous shift comments or skin assessments. Make your notes your own. Use your voice when you're documenting about your patient. Don't use someone else's words. Please do not document incorrect data. And what I mean by this is that from time to time it is discovered that a staff member does not wish to wake up a patient at 4 a.m. to do vital signs if there's nothing else that needs to be done. This may sound very simple, but please do not make up vital signs and enter them. That's what I mean by documenting incorrect data. Do not document interpretations. If you do not have the qualifications to make an interpretation, do not document it. And do not document the provision of care prior to providing it. This would include any kind of check sheet that needs to be done every hour or every 2 hours. We have very few handwritten check sheets at this point, but it has been known to happen, so please do not do that. And remember, incomplete documentation is the most common piece of evidence in a pressure sore litigation case. Now, remember that common complaints made against nurses include the failure to follow the standard of care, a failure to communicate, a failure to assess and monitor a patient appropriately, failure to report significant findings, failure to act as a patient advocate, and a failure to document. And just to leave you with an interesting tidbit, this is a documentation example that was found in a chart several years ago. And I'll go ahead and read it for you. The IV beeping again. PCT went to the room to see what was wrong with the IV. The patient states, "I called for the fat-ass bitch nurse and they sent you in." Went in the room and told the patient that the fat-ass bitch nurse was here and what did she need. Now, you can see the rest of this. I found out about this particular bit of documentation when the patient made a complaint about the nurse's behavior. And respectfully, that nurse wrote what actually happened. Please feel free to document what your patients say. Quote them by all means. If a family member says something ugly to you and it pertains to patient care, by all means document it. However, please do not repeat it back to the patient or their family. There are references for you to see, and if you have any questions, please feel free to contact me at joy.jackson@erlanger.org or at my extension of 5808. And for those outside of the Baroness campus, that would be 423-778-5808. Thank you and have a great day.